So what is a bone scan and why do we need it? In dentistry, there's a lot of things that we can't see. We can't see under fillings, we can't see under crowns, we can't see bone levels because it's covered by gum. We also can't see in between teeth. So one of the things is we take a lot of x-rays, and we take x-rays, as you probably know, of x-rays in the mouth. The idea here is to really get an idea of all the things that we need to diagnose before deciding what treatment to actually do. The main issue with all of these x-rays is actually that they're two dimensions. So we can only really see certain things, but it's a flat image. We don't get to see everything in 3 dimensions. And it's fine if we're doing restorations and things like that. When we're doing implant surgery and sometimes extracting teeth, for example, very deep wisdom teeth, it is really important to know exactly what's going on in 3 dimensions. And that's where what we call CT or cone beam scans actually come from. So a bone scan is sometimes called a CT, it can be called a CAT scan, and what it is computerized tomography. They're all basically the same name, whether it's called CT or CAT scan, and what we're talking about here is getting a 3-dimensional scan of the bone and the mouth in order to actually plan things. So the most important thing is that a patient will actually go to a radiographic clinic, and what they will do is they will get a CT scan back. That data will actually come back to us on a disc, and this disc can be loaded in a computer system, and we can then plan all of the treatment that needs to be done before actually doing it on the patient. The most important thing about a CT scan is it's 3 dimensions, so we can see the height and the width of the actual bone in the teeth, and we can actually plan everything virtually before actually doing any treatment. It is very, very safe to do. We can predict also the treatment. We can make sure that the treatment is going to be successful before we even start it. And there's even the scope of actually using this technology to do computer guided surgery, where we're actually using a computer to guide the placement of implants, and again, increase the safety factor when it comes to doing implant treatment.